This x-ray is shown in this figure, and we have to look at and diagnose the disease, that which disease is shown in this, which abnormal findings are present in this chest x-ray. So this is right side of the patient and this is left side of the patient, and as we have seen that we have discussed that there are two angles in the x-ray. One is cardiophrenic angle, which is present here, and another is costophrenic angle. So the cardiophrenic angle and costophrenic angle of right side of the x-ray is normal, while in left side there is absence of loss of cardiophrenic and costophrenic angle, and there is homogeneous opacity in lower lobe and middle lobe of the patient, and this homogeneous opacity indicates some diseases. And another thing which we have to see in this x-ray is trachea, which is shifted towards opposite lung or shifted toward the right side, because affected lung is left side and right side is normal, and trachea is shifted toward the right side, or we can say it is shifted opposite to the uh, affected lung. So trachea is shifted opposite in the affected lung in two types of the diseases. When trachea is shifted to the opposite in two types of the disease, one is pleural effusion and another is pneumothorax. In pneumothorax, these two conditions are present when which patient in which trachea is deviated opposite to the affected lung, and if trachea is moved toward the affected lung in also two types of the diseases. When trachea is shifted towards diseased lung in fibrosis, in pulmonary fibrosis, or in collapse of the lung. Trachea is shifted toward the diseased lung. So here in this x-ray we can see that trachea is shifted away are opposite to the affected lung. So we can figure out that a homogeneous opacity is present, loss of cardiophrenic and costophrenic angle, and trachea is shifted opposite. So there is pleural effusion, because as we discussed in pleural effusion and pneumothorax, trachea is shifted toward the opposite. So pneumothorax is not shown in this figure, while not pneumothorax is not present, so we can label this as pleural effusion. So what is the diagnosis? There is the pleural effusion and homogeneous opacity of the left lower lobe and middle lobe, and loss of costophrenic and cardiophrenic angle. Here loss of cardiophrenic and costophrenic angle. There is meniscus positive, and trachea is shifted to the opposite side of the diseased lung, and that opposite side of diseased lung indicates there is pleural effusion. And other conditions which causes these complications are pneumonia, TB, COPD, and malignancy. And diagnosis is pleural effusion, and treatment is treating the underlying cause, and we can give antibiotics to the patient. We should perform chest intubation or aspiration and drainage. We have to aspire and drain the fluid out of the lung, and we also should perform pleurodesis in order to relieve the affected lung from pleural effusion. So in this way we can interpret x-ray of the chest by looking at which side of uh, lung is affected. By labeling right and left, we have to look at cardiophrenic and costophrenic angle, the position of the trachea which is shifted opposite, and trachea shifted opposite in pleural effusion and pneumothorax, while trachea is shifted toward diseased lung in pulmonary fibrosis and collapse. So in this way we can figure out the disease, and we can estimate that what is the diagnosis from x-ray of the patient.